lot of our patients have multiple skin issues, and pigment is a concern to not make it worse but actually improve it no matter what skin type you have. So this lovely patient has acne problems, and she volunteered for us to show how we get rid of acne and clear up her face within a matter of days. And what we're going to do today is we're going to remove her inflammation manually. Then we're going to place a little salicylate on there based on her skin type, and then her body is going to heal it up. And over a period of time, if you get one of these once a month, it will clear up your skin and make it brighter no matter what your underlying skin tone is. This kind of acne, it hurts, and it's very frustrating because your hormones wreak havoc, the sun wreaks havoc with it. So she's oozing plasma now, which is a good sign of any type of acne. So here we go with our salicylate, and the dose we use on this depends on the patient. So we did a test spot on her last week or a week before, and it's worked really well. So a lot of times what we'll do is we will perform a test spot to see how a patient does before we actually do the inclusion treatment. And so sometimes if you haven't had a chemical peel before, we will just do one just to see how your skin responds before we combine them together. Okay. Because when you have an open, as you can see here, I'm going to turn. The salicylate is only acting on the areas that are irritated. So an open, it's aspirin. It's treating inflammation. So she's gonna get a little frosting. As she fans her, you'll see more and more whitening of the skin, but it's very superficial. And again, only treating the areas of inflammation. Okay, turn it towards me and I'll do the other side. And we'll reproduce this in a month. And what happens a lot of times with that first peel without the inclusion treatment, you'll really break out. It kind of brings things to a head, and then it really clears you well. And so by doing this, you avoid that rapid response phase. So now on this side of the face, you can really see the whitening of her tissue. Let's see that. So let's get her dry here. It's just a matter of drying the skin. And so you can see how she's got really, really highlighted whitening. So it's just kind of like you took a highlighter and on all your spots. Okay, that looks really good. We're gonna look at the other side, and I still need to do your nose. We don't want to leave anybody out. That looks really good. And so she's gonna wash this off in 4 hours. And she'll be peeling for the next 5 days. You've had this peel before. How many days did you peel? Was it about 5 days or? Okay. We do a bunch of different peels, so I just want to make sure that's what she did with her. So. Okay. Okay. And that is our inclusion, removal, and salicylate combo peel, only available here at Healthy Skin Clinic to treat your particular needs. And hopefully this demonstrated that both Caucasian, Spanish, and African American skin can tolerate this procedure really well.